linear guides, anatomical guides, anatomical limits, origins, branches, and relations to the vein for mortuary science for preparation for the NBE, the National Board Exam for Science. This is not safe for work. Latin pisses me off. Industry jargon pisses me off. You know, I'm gonna cuss up a storm, so please wear an earbud. I can't help it. So, I'm also going to repeat myself a lot in some places. This is for the purpose of committing this to memory. Because the first time that my friends and I, who have no previous medical experience, no previous funeral services experience, the first time that we saw these things, you might as well have been showing us Chinese. We're literally learning another language. We're learning Latin and medical jargon. And nobody wants to fucking teach it. So I'm going to attempt. So here we go. Anatomical position. That's a term that means the standardized way to describe the body's orientation, used as a reference point in anatomy and medicine. In anatomical position, the body is standing upright, facing forward, feet flat on the ground, arms at the sides, and palms facing forward. That could potentially be important when you're sitting for the board exams. If you reference your physical body to check yourself or jar your memory, make sure you turn your hand over so that you're looking at your palm. If you look at your hand with your palm down flat on the desk, you might fuck yourself up. So, superior and cranial. Same thing, superior and cranial. It means above or higher than another part of the body proper. Towards the head of the body, upper. The hand is a superior extremity. Your head is cranial to your ass. Your eyes are superior to your mouth. Inferior and caudal. Inferior and caudal. Caudal, inferior. Away from the head, lower, and in the textbook, near or towards the tail. Now, humans don't have a fucking tail, but since it's in the textbook, these slick little assholes on the board exam might throw that in there, maybe as a multiple choice. So if you see near or towards the tail, it's legit. The foot is a caudal extremity. The pelvis is inferior to the abdomen. Inferior, caudal. And humans have a fucking tail. Anterior or ventral. Anterior and ventral. Front or toward the front of the body. Toes are anterior to the foot. The kneecap is on the anterior side of the leg. Anterior, ventral, front of body. Anterior, ventral, front of body. Posterior and dorsal. Posterior and dorsal. Back or direction towards the back. The popliteus is posterior to the patella. The popliteus is the Latin bullshit word for the muscle on the back bend of the knee. Patella is the fancy word for kneecap. So, the back of your knee is posterior to your kneecap. Popliteus is posterior to the patella. The shoulder blades are located on the posterior dorsal side of the body. Medial, toward the midline of the body. The middle toe is located at the medial side of the foot. Your fuck you finger is the medial finger. Now, hallux is the fancy word for the medial toe. It's in the textbook with the definition of medial, so you might see it. Hallux is the middle toe. Hallux is the medial toe. Lateral, away from the midline of the body, describes side or direction toward the side of the body. And this is important for your visual. You want to try to visualize this in your head. See how on this image the palms are facing front and the thumb is away from the body. If you mess up and you look at your hand with your palm down, it makes it look like the thumb is medial. And that could happen also with the arteries. If you have anxiety and you look at your hand and you get mixed up. So the palm is very important. In the anatomical position, it's facing outward. If you look at your hand for reference, laying it on the desk, put the palm up and look at your palm. So the thumb, aka pollex, is lateral toward the side of the body. The pinky or little finger is medial toward the midline of the body. The thumb is lateral. The pinky toe is located on the lateral side of the foot. The big toe is also medial. Proximal, toward or nearest the trunk or the point of origin of a part. Example, the proximal end of the femur joins with the pelvic bone. Distal, away from or farthest from the trunk or point of origin of a part. The hand is located at the distal end of the forearm. Superficial describes a position closer to the surface of the body. The skin is superficial to the bones. Deep describes a position farther from the surface of the body. The brain is deep to the skull. The planes of the body, the coronal plane, also called frontal plane, coronal frontal is a vertical plane running from side to side, divides the body or any of its part into anterior and posterior portions. So coronal frontal divides the body into front of body and back of body. Sagittal plane, also called lateral plane. Sagittal lateral plane is a vertical plane running from front to back, divides the body into right and left sides. So sagittal, lateral divides the body into the lateral sides. Sagittal and lateral rhyme together. So remember, sagittal is lateral, coronal is frontal. Coronal, frontal, sagittal, lateral. Axial plane, also called transverse plane. Axial, transverse is a horizontal plane that divides the body into upper and lower parts. So axial transverse divides the body into superior and inferior, cranial and caudal. Axial transverse cuts you in half right at your hips. Axial transverse cuts you in half at your hips and divides you into superior cranial and inferior caudal. Axial transverse, superior cranial, inferior caudal. Median plane is the sagittal plane through the midline of the body that divides the body or any of its parts into right and left halves. That's like the medial plane, like goes straight down from the crown of the head and divides it into just right and left. Linear guide, a line drawn or visualized on the surface of the skin to represent the approximation location of some deep-lying structure. Anatomical guide, reference for location of arteries and veins by means of anatomical structures which are known. So remember, linear guide, surface of the skin. Linear guide is always going to say something about drawing a line or points that you can touch on the or see on the surface of the skin. You know that's a linear guide. Anatomical guide is using muscles, tendons, arteries, and anatomical structures that are underneath the skin to describe where something is. So to differentiate, you just have to determine, are we beneath the skin or are we on top of the skin? Linear guide's on top of the skin, anatomical guide is beneath the skin. Anatomical limit, points of origin and termination in relation to adjacent structures used to designate boundaries of arteries. Origin for the right common carotid artery is the terminal branch for the brachiocephalic artery. Origin for the left common carotid artery branches off of the arch of the aorta. Right common carotid brachiocephalic, left common carotid arch of the aorta. Right brachiocephalic, left arch of aorta. Right brachiocephalic, left arch of the aorta. Branches for the right common carotid artery. They are the terminal bifurcation into the right internal and external carotid arteries. Branches for the left common carotid artery, terminal bifurcation into the left internal and external carotid arteries. So the branches for the right and the branches for the left are the same. Right with right, left with left. Right into the right internal, left into the left internal. Linear guide for the common carotid artery. Visualize a line on the surface of the skin from a point over the respective sternoclavicular articulation to a point over the anterior surface of the base of the respective earlobes. The sternoclavicular articulation is a fancy word for the bump where the clavicle ends underneath the chin. It's something that you can feel with your finger from outside your body. And the anterior surface of the base of the respective earlobes just means the bottom of the earlobe on the same side. So the linear guide for the common carotid artery, the way that you would use this, which I wish someone would have fucking explained to us right from the get, was you're in the lab. Take a ruler or one of the instruments that's straight and put one end where you feel that bump at the end of the clavicle, the other end touching the base of the earlobe on the same side. And in a perfect world, your carotid is right there. So you know where to make your incision. Anatomical limit for the left common carotid artery begins at the level of the second costal cartilage and extends to the superior border of the thyroid cartilage. Left common carotid artery is on some bullshit compared to the right. The right is normal. It's right there at the neck where everybody expects the carotid to be. The left side is running all the way down there to the second rib. And costal cartilage is just the medical bullshit way of talking about the cartilage that connects the rib to the sternum. There's cartilage that connects the rib to the sternum. So the left common carotid artery begins at the second rib, at that costal cartilage, and extends to the uppermost border of the thyroid cartilage at the neck. Relationship of the common carotid artery to the internal jugular vein. The internal jugular vein lies lateral and superficial to the common carotid artery. So the internal jugular vein lies towards the side of the body and closer to the surface of the skin than the common carotid artery. So when you are cutting in, you will see the jugular vein first. And if you go a little deeper to the side of it, you will find the carotid right underneath it to the side. You have to visualize this. Anatomical guide for the common carotid artery. So now we're really beneath the skin. It's posterior to the medial border of the sternocleidomastoid muscle. So the anatomical guide for the common carotid artery, it's to the back, to the middle border of the sternocleidomastoid muscle. So if you are digging in from the front of the body, the anterior side of the body, you will have to go beneath the sternocleidomastoid muscle, deeper towards the back of the body, posterior, to get to the common carotid artery. It is posterior to the medial border of the sternocleidomastoid muscle, posterior to the back to the medial middle border of the sternocleidomastoid muscle. Anatomical limit for the right common carotid artery begins at the level of the right sternoclavicular articulation and extends to the superior border of the thyroid cartilage. Level, right common carotid artery, level of the right sternoclavicular articulation to the highest border of the thyroid cartilage. Considerations for the common carotid artery. Very large in diameter, very elastic, very rarely found sclerotic, supplies fluid directly to the head, situated close to the center of fluid distribution, and is accompanied by a very large vein that can be used for drainage. Disadvantages to using the common carotid artery. Incision may be visible after dressing. Face may be over-injected. Dye may not be evenly distributed in the face, and positioning of tubes against the face may leave marks. Origin for the axillary artery. It is a continuation of the subclavian artery. Linear guide for the axillary artery. Visualize a line on the surface of the skin from a point over or through the center of the base of axillary space to a point over or through the center of the lateral border of the base of axillary space, running parallel to the long axis of the abducted arm. All right, let's take that bullshit right there and put it in English. Axillary space just means motherfucking armpit. Armpit. The axillary space is the armpit. And the long axis of the abducted arm, all abducted means is to take the arm and fucking move it away from the midline of the body. So you're just like fucking putting your arms out like you're gonna fly. Okay? And the long axis of the abducted arm just means like raise your fucking arms up like you're gonna try to fucking fly. And there's a line going from your armpit down the center, down to your fuck you finger, you know, so you can tell all these assholes to eat shit with your bird finger. That is the long axis of the abducted arm. So the linear guide for the axillary artery. We're going to visualize a line on the surface of the skin from a point over or through the center of the base of the armpit to a point over or through the center side border of the base of the armpit, running parallel down the arm to the bird finger. That's how the axillary artery runs from the armpit down the arm. It's pretty fucking simple. Just right down the fucking center. If you got your arm out with your palm down. So, when you see it, it's going to say axillary artery over or through the center of the base of the axillary space, armpit, to a point over or through the center of the lateral side border of the base of the axillary space, running parallel to the long axis of the abducted arm. Don't let all the fancy words intimidate you. It's all bullshit. Anatomical guide for the axillary artery. Posterior to the medial border of the coracobrachialis muscle. Anatomical guide for axillary artery. Posterior towards back to the medial middle border of the coracobrachialis muscle. This muscle is the one on the inside of your arm, on your inner upper arm that touches your ribs under your armpit. Anatomical guide for axillary artery. It is towards the back to the middle of the coracobrachialis muscle. This inner armpit touching muscle. Posterior to the medial border of the coracobrachialis. Axillary artery posterior towards the back of the medial border of the coracobrachialis. Anatomical limit for the axillary artery begins at the lateral border of the first rib to the inferior border of the tendon of teres major muscle. The teres major muscle is basically an armpit muscle that attaches to the scapula and comes under the armpit around to the humerus. It works on the shoulder joint. And let me see. And the axillary artery, the anatomical limit for the axillary artery, it is the side border of the first rib to the lower inferior border of the tendon of teres major, this armpit muscle. Anatomical limit axillary artery begins at lateral border of first rib to inferior border of tendon of teres major, armpit muscle. Scapula to armpit, teres major. Coracobrachialis and teres major are to do with the axillary. Those are both armpit muscles. Relation of the axillary artery to the axillary vein. The axillary artery is located lateral and deep to the axillary vein. So the axillary artery is to the side and deeper than the axillary vein. When you are digging in that armpit, you're going to see the vein first and then see the axillary artery to the side and deeper, just like the carotid. Linear guide for the brachial artery. Visualize a line on the surface of the skin from a point over the center of the lateral border of the base of axillary space to a point approximately 1 inch below the front of the elbow joint. So in English, linear guide for brachial artery, a line on the surface of the skin from a point over the center of the side border of the base of the armpit to a point approximately 1 inch below the front of the elbow joint. And see, these assholes just kind of like jump back and forth between using English and Latin or medical jargon. So when you see that, it might say approximately 1 inch below the anterior antecubital fossa. Antecubital fossa is an asshole word for the elbow joint, for the bend of the elbow. So again, linear guide brachial artery. Line on the surface of the skin from a point over the center of the lateral border of base of axillary space to point approximately 1 inch below front of elbow joint or anterior antecubital fossa. Visualize a line on the surface of the skin from a point over the center of the side border of the base of the armpit to approximately 1 inch below the front of the elbow joint. Brachial artery. Anatomical guide for the brachial artery lies in the bicipital groove at the posterior margin of the medial border of the belly of the biceps brachii muscle. So it lies in the groove of the bicep towards the back of the body, in the middle border of the belly, which is like the middle of the fattest part of the bicep muscle. The anatomical guide for the brachial artery is it's in your fucking bicep, underneath it, towards the back of your body, in the groovy part. Anatomical limit for the brachial artery. This is the limit instead of the guide. Begins at the inferior border of the tendon of teres major to a point inferior to the antecubital fossa. In English, anatomical limit for brachial artery begins at the bottom border of the tendon of the scapula to armpit underneath muscle to a point towards the bottom, towards the fingers of the elbow joint. So the bottom of the elbow joint towards the fingers. Begins at the inferior border of the tendon of teres major muscle to a point inferior to the antecubital fossa. See how I took something really fucking simple and I just made myself sound really fucking smart, but I'm not? That's how this works. Origin for the brachial artery. Continuation of the axillary artery. It goes axillary in the armpit, goes down to brachial, then it goes down to radial. Relation of the brachial artery to the basilic vein. The accompanying basilica vein is located medial and superficial to the brachial artery. The accompanying basilica vein, isn't that some kind of Catholic thing? Basilica. Yeah, whatever. The accompanying basilica vein is located to the middle and towards the surface of the skin above the brachial artery. So the brachial artery is similar to the axillary and the carotid. When you're digging in there, you know, and apparently the fucking brachial artery is Catholic, I guess. It's got a fucking basilica. When you're digging in there, you're going to hit the vein first. But the difference is the artery is right underneath it in the middle. It's not to the side like the axillary and the carotid is, but the brachial artery is also on top. It just happens to line up. Maybe it's because of the basilica, you know. Yeah, maybe it was the Holy Ghost. But when you get to the brachial artery and the basilic vein, they are directly lined up on top of each other instead of, you know, one being goofy and off to the side. So, yeah, maybe that'll help remember it. I don't know. Considerations for the axillary brachial arteries. Arterial fluid flows directly into arm and hand. Artery is close to the face. Vessels are superficial and close to the center of fluid distribution. So, backing up for just a second, relation of the brachial artery to the basilic vein. The accompanying basilica vein is located medial and superficial to the brachial artery, whereas the ones above it, like I was saying, are off to the side. The basilica is a special Catholic thing. It's some sort of building that was granted special privileges by the Pope. So remember that the brachial artery and the basilic vein, I guess, have been granted special privileges by the Pope, and so they're like directly on top of each other instead of off to the side. That's how I'm going to remember it. All right. Thought I was going crazy there for a second. Disadvantages to using the axillary brachial arteries. Axillary and or brachial arteries. The arm must be extended, abducted, if you want to sound like a smart piece of shit. The arm must be extended, especially if the vein is to be used for drainage. The artery is too small to be used as a primary injection site. The artery can look like a vein, and there are many anomalies and numerous branches. So, disadvantages to using the axillary brachial arteries. Just remember that the armpit's a bitch and a pain in the ass, is basically what's going on there. The armpit is a pain in the ass. Linear guide for the radial artery. Oh, it's a pain in the ass, but the brachial has special privileges from the Pope. Yes. Linear guide for the radial artery. Visualize a line on the surface of the skin of the forearm from the center of the antecubital fossa to the center of the base of the index finger, pointer finger. So, in English, because I'm not an asshole, a line. Origin of the radial artery is the bifurcation of the brachial artery. Remember, it goes axillary, brachial, radial, down the arm. Anatomical guide for the radial artery lies lateral to the tendon of the flexor carpi radialis muscle and just medial to the tendon of the brachioradialis muscle. Anatomical guide for radial artery, lateral to the tendon of flexor carpi radialis, medial to tendon of brachioradialis. The flexor carpi radialis is the muscle that comes down one side of your forearm from your elbow, your inner forearm. And the brachioradialis is the muscle that comes down the top of your forearm from behind your humerus, your upper arm bone. So, anatomical guide for the radial artery. Lateral to the tendon of the flexor carpi radialis muscle and medial to the tendon of the brachioradialis muscle. So those two muscles that wrap down the front and back of your forearm. Radial artery. Lateral towards the outer side of the body of the carpi radialis into the middle of the tendon of the brachioradialis. The anatomical limit for the radial artery, it begins 1 inch inferior and anterior to the bend of the elbow, antecubital fossa. Assholes might say that too. To a point over the base of the thumb. So, anatomical limit for the radial, 1 inch inferior below and anterior towards the front of the body to the bend of the elbow, antecubital fossa, to a point over the base of the thumb. Relation of the radial artery to the vena comitantes. 2 small veins lie on either side of the artery. This is actually the same for the radial and the ulnar. These veins may be helpful in locating it because they generally contain some blood. They are called the vena comitantes. Remember that the radial and the ulnar have 2 twin veins with some kind of Latin, Spanish bullshit name that sounds like they're being called communists. So they're the vena comi vein buddies of the radial and the ulnar. Origin for the ulnar artery, bifurcation of the brachial artery. So that is actually the same as the radial also. Bifurcation of the brachial artery. Linear guide for the ulnar artery. Visualize a line on the surface of the skin from the center of the antecubital fossa on the forearm to a point between the fourth and fifth fingers. So, linear guide for ulnar artery. Line on the surface of the skin from the center of the inside of the elbow to a point between the pinky and wedding finger. Remember that the ulnar comes in medial. It runs down medial when we're talking about the pinky finger because the palm is up, whereas the radial artery runs down lateral, runs out to the other side of the hand to the thumb because the palm is up. So remember, radial goes to the thumb, ulnar goes to the pinky. Well, between the pinky and the wedding finger, it's fucking close enough. Fourth and fifth finger, pinky and wedding finger. Ulnar artery, center of the antecubital fossa to a point between the fourth and fifth fingers. Anatomical guide for the ulnar artery. Lies lateral to the tendon of the flexor carpi ulnaris muscle, lies between the tendons of the flexor carpi ulnaris and flexor digitorum superficialis. So, anatomical guide for the ulnar, lateral toward the side of the body to the tendon of the flexor carpi ulnaris muscle, between the tendons of the carpi ulnaris and the flexor digitorum superficialis. So remember, the radial has carpi radialis in it and brachioradialis. So radial is in it. And for the ulnar, carpi ulnaris is in it. Carpi ulnaris and flexor digitorum is the ulnar. Anatomical limit for the ulnar artery begins 1 inch inferior and anterior to the bend of the elbow, to which they might say antecubital fossa, bend of the elbow, to a point over the pisiform bone. So, anatomical limit for the ulnar, 1 inch below and to the front of the body in the bend of the elbow to a point over the pisiform bone. The pisiform bone is a tiny pea-shaped, pisiform pissant bone. Tiny little thing that is on the side of the wrist above the pinky. And it helps to bend the wrist in the direction of the pinky. So remember, pissant bone with little pinky finger. Little pissy bone, little pinky finger. And the ulnar goes down to the pinky pissy side of the hand. So there you go. Anatomical limit for ulnar artery, 1 inch inferior and anterior to the bend of the elbow to a point over the pisiform bone. Relation of the ulnar artery to the venae comitantes, the little communist twin vein buddies. Same thing, 2 small veins on either side of the ulnar artery, helpful in locating it because it contains some blood. Origin for the femoral artery. It is a continuation of the external iliac artery. And it's important to remember external. It's not common iliac. It's not internal iliac. It's external iliac. We deal with the external iliacs. The internal iliacs are the arteries that go back posterior to the butt cheeks. So we deal with the external iliac. External iliac. Linear guide for the femoral artery. Visualize a line on the surface of the skin of the thigh from the center of the inguinal ligament to the center of the medial prominence of the knee, also called the condyle in case they want to be smartasses. Here we go. I might be repeating myself. I don't know anymore. Linear guide for the femoral artery. Visualize a line on the surface of the skin of the thigh from the center of the inguinal ligament to the center of the medial prominence of the knee. So I tried to get a picture of some sexy abs on a dude, and instead I got a poom poom. But there you can see it. It still shows the side of the V quite well. It is the center of the V, going down to the part of the knee that sticks out. Center of inguinal ligament to center of middle prominence of the knee. Anatomical guide for the femoral artery. Passes through the femoral triangle and is bounded laterally by the sartorius muscle and medially by the adductor longus muscle. Anatomical guide for the femoral. Passes through the femoral triangle, bounded to the side by the sartorius and in the middle by the adductor longus. So, anatomical, femoral triangle, laterally by sartorius, medially by adductor longus, bounded by the outer side in the sartorius and in the middle by the adductor longus. Anatomical guide for the femoral triangle, laterally by sartorius, medially by adductor longus. Anatomical limit for the femoral artery. Begins posterior to the center of the inguinal ligament to the opening in the adductor magnus. Anatomical limit for the femoral artery. Towards the back to the center of the inguinal ligament to the opening in the adductor magnus. Anatomical limit for the femoral is posterior to the center of inguinal ligament, adductor magnus muscle. So don't get those two mixed up. The guide goes through the femoral triangle, laterally by sartorius, medially by adductor longus is the guide. The limit begins posterior to center of inguinal to the opening in adductor magnus. Limit goes to magnus. Anatomical guide goes to adductor longus, because they're going to put both of those as probably a multiple choice on both questions about this because they're cunts. So you have to really repeat that one because it's the Latin bullshit. Anatomical guide for femoral passes through femoral triangle, bounded laterally by sartorius, medially by adductor longus. Anatomical limit for femoral begins posterior to center of inguinal to the opening of adductor magnus. Relation of the femoral artery to the femoral vein. The femoral artery lies lateral and superficial to femoral vein. The femoral artery lies to the side and closer to the skin than the vein. So the femoral is different than those others in the upper body. In the upper body, the vein was on top. In the leg, the artery's on top and off to the side. So in the leg, you have to dig deeper and off to the side a little bit to get the vein. It's two opposite sides of the body. The artery is different. It's like opposite as far as being superficial or deeper. The femoral artery is lateral to the side and closer to the skin, superficial to the femoral vein. You have to dig down deeper to get the vein in the leg. Considerations for the femoral artery. The artery is large in size. The incision is not visible. Both sides of the head will receive an even distribution of solution and is accompanied by a large vein that can be used for drainage. Disadvantages to using the femoral artery. Very often found sclerotic. In obese bodies, the artery is very deep. Obviously, because, we all get thunder thighs and shit. And if you got a thunder thigh, you're digging like a foot down in there to get to these little shits. And there is no control of the solution entering the head. Disadvantages of the femoral artery. Sclerotic, in obese people, deep and no control of the solution entering the head. So, side note, with the anatomical guide, the sartorius muscle and adductor longus muscle can be used to help find the femoral artery. Sartorius and adductor longus can be used in the anatomical guide to help find the femoral artery. And that's it. Hope this was helpful.